Assalamu alaikum wa rahmatullahi wa barakatuh. Hi everybody, welcome to our radiology course for undergraduate. I am Alaa Muhammad Reda, lecturer of radio diagnosis. Today we will talk about basics for urinary imaging. At first, our objectives today: methods of examination of the urinary system, normal radiological anatomy of the urinary system, and common pathological diseases of the urinary system. Let's start with methods of examination of the urinary system. Many methods are used for examination of the urinary system, starting from the most important for our level is plain X-ray and contrast studies as IVU, ascending urography, cystography, and ascending retrography. Third one is ultrasound, CT or computed tomography, multi-slice, MRI or magnetic resonance imaging, and radioisotope scanning or nuclear medicine. The most important for our level is plain X-ray and contrast studies. Let's start with plain X-ray of the abdomen and pelvis, or PUT, or plain urinary tract, or KUB, the same meaning, kidney, ureter, bladder. It is the basic and the initial diagnostic modality for assessment of any pathology in the kidney, urinary bladder, or ureters. It includes either anteroposterior view, or in some cases we do lateral views. The patient is lying supine on the table, and the X-ray tube or X-ray machine is in the anterior position of the patient, and X-rays penetrate the abdomen and pelvis of the patient to be received by the receptor on the opposite side. This is anteroposterior view for abdomen and pelvis, or PUT or KUB. The PUT or KUB should include from above the last 2 or 3 dorsal vertebrae with the lower 2 ribs, and from below 1 inch below the symphysis pubis, like in this image. Last 2 ribs on both sides are included in the study, with last 2 dorsal vertebrae from above, and from below 1 inch below the symphysis pubis is included in the image to examine the urethra. So it is complete film for examination of the urinary system, or good PUT or KUB. The KUB or PUT is important for assessment of the bone of the patient and the soft tissue shadows such as psoas shadow on both sides. Also important for assessment of any calcification or any radio-opaque shadows such as stones in the region of kidneys, ureters, and urinary bladder or urethra. This is the normal kidney, ureter, urinary bladder, or KUB. This is the shadow for the right kidney, and this is the shadow for left kidney. This is the psoas muscle shadow on both sides, and the transverse processes of lumbar vertebrae. Opposite to each lumbar vertebrae transverse processes, the ureter is descend downwards in its lumbar course to reach its vesico-ureteric orifice in the urinary bladder. So this is the picture of normal KUB. The second imaging modality is contrast studies. First one is IVU or intravenous urography, which is a study of the urinary system after injection of IV contrast media that excreted into the urinary system. So examine the urinary system starting from the minor calyces. The minor calyces open into 3 major calyces: upper, middle, and lower major calyx. The 3 major calyces open into the renal pelvis on both sides and end in the ureter, with its upper third opposite the transverse processes of the lumbar vertebrae, the middle third opposite the sacroiliac joint on both sides, and the lower third in the pelvis ending into the vesico-ureteric orifice on both sides and the urinary bladder. So IVU is important for examination of the urinary system, any filling defects such as stones, any dilatation in the pelvic calcial system and ureters, which called hydroureteronephrosis, means there is distal obstruction, and examination of the urinary bladder with filling defects or any abnormality in its contour or in size or in shape. So it's very important imaging modality in the urinary system. Another zoomed image for IVU. It is the minor calyces opening into 3 major calyces and the renal pelvis on both sides, and the ureters starting from the renal pelvis to its end into the vesico-ureteric orifice in the urinary bladder. There is some contraindications for doing IVU in some patients, such as sensitivity to contrast media, impaired renal functions, and pregnancy. The second imaging modality in contrast media is cystography. Cystography is important imaging modality for the urinary bladder by introducing a urinary bladder catheter, then injection of contrast medium and imaging the patient for assessment of the urinary bladder. The third one is ascending urethropography, which is important for assessment of the urethra of the patient. Male patient urethra is composed of 4 parts. 2 parts consistent with anterior urethra, which is a penile part and bulbar urethra, and 2 parts consistent with the posterior urethra, which is the membranous part, and the prostatic part, which is surrounded by the prostate, ending into the urinary bladder neck and the urinary bladder. So the ascending urethropography is important imaging modality for assessment of the male urethra, including strictures, filling defects, any abnormal soft tissue lesions, and also if there is abnormalities into the bladder neck, such as prostatic enlargement or prostatic hyperplasia or prostatic carcinoma. The third imaging modality is ultrasound, which is available and non-invasive modality, no exposure to radiation, no exposure to contrast medium with its complication. So it's very important for evaluation of the urinary system. This is the normal appearance of the renal tissue. This is the right kidney, its upper pool and its lower pool, and this is the region of the sinus fat, and this is the capsule of the kidney, very thin capsule from outside, and this is the cortex of the renal parenchyma or the outer portion of the renal tissue. Ultrasound is important as it assesses the renal parenchymal thickness, important for assessment of any stones, any abnormal hydronephrotic changes, any cysts or masses may appear very clear in ultrasound. So it's very important modality in urinary system assessment. The fourth one of imaging modalities is computed tomography or CT scan multi-slice. Is a very recent technique for assessment of the renal system. This is a machine of CT scan. The patient is lying on the table like this and entering into the gantry or the opening of the CT machine. It can examine large portion or large volume of the body in very short time with reconstruction of the image into 3 dimensions, and can examine the patient into axial or transverse cuts or coronal views or coronal cuts, or also sagittal views, then reconstructing the image into 3 dimensions. This is the right kidney in the CT scan, and this is the left kidney in CT scan, and this is the right ureter. MRI or magnetic resonance imaging is a recent modality also for imaging of the urinary system. This is the MRI machine, and the patient is introduced into the opening of the machine, and imaging is acquired to give image like the picture of IVU, but without using of any contrast medium. So MRU is very important modality in cases of sensitivity to contrast medium or any contraindication such as pregnancy. We can't use contrast medium in these cases, so we can replace the modality by MRU, which is very important in these cases. The fifth one is nuclear medicine or renal isotope scanning, and it's very important imaging modality for assessment of both morphology and also the function of the renal tissue. And this is image for renal isotope scanning or nuclear medicine. The first section in our lecture is finished. Let's go to the second one, which is normal radiological anatomy of the urinary system. The anatomy of the kidney. This is diagram for anatomy of the kidney. This is the kidney. This is upper pool. This is lower pool, and this thin capsule from outside is surrounding the kidney. And the outer portion of the renal tissue or renal parenchyma is called the cortex of the renal tissue, and this dark gray zone is called the medulla or the inner portion of the renal tissue. So this is the cortex. The light gray is the cortex and the dark gray is the medulla of the renal tissue. The medullary portion is composed of multiple triangular shaped structures, which is called medullary pyramids. Medullary pyramids has the tip inwards. This tip is called the papilla. The papilla is projected to the minor calyx. Each papilla is projected to minor calyx, and many minor calyx opening into one major calyx to have three major calyx, lower and middle and upper major calyx. The three major calyces open into one renal pelvis and opening into the ureter. Each medullary pyramid, in between each medullary pyramid and the nearby one, there is a structure called column of Burton. So again, this is the capsule surrounding the kidney. This is the cortex. This is the medulla, and each one is called the medullary pyramid, has a tip called the papilla of the medullary pyramid, opening into the minor calyx, then major calyx, then renal pelvis, then the ureter. The ureter is descent downwards and composed of three portions or three parts in its course. The upper third, which is opposite to the transverse processes of the lumbar vertebrae, the middle third, which is opposite to the sacroiliac joint, and the lower third is from after the sacroiliac joint to its end into the vesico-ureteric orifice, which is the pelvic portion of the ureter on both sides. This is a normal IVU or intravenous urography. This is the shadow for right kidney, shadow for left kidney, minor calyx, opened into upper major calyx, middle major calyx, lower major calyx, renal pelvis, and ureters on both sides, and ending into the vesico-ureteric orifice into the urinary bladder. Then the male urethra, which is composed anatomically of four parts, two parts consistent with the anterior urethra and two parts consistent with the posterior urethra. The anterior urethra is penile and bulbar. The posterior urethra is membranous and prostatic. This is the anterior urethra, composed of penile urethra. Till the penoscrotal junction begin the bulbar urethra. This is the anterior urethra. Then the posterior urethra, which is composed of two parts membranous urethra, then veromontanum, which is normal anatomical elevation, and short one, which is called prostatic urethra, which is surrounded by the prostatic tissue or the prostate to end into the urinary bladder neck and the urinary bladder. Again, benile, bulbar urethra, membranous urethra, veromontanum, and prostatic urethra. This is a picture for ascending urethroplasty by injection of contrast medium through small catheter into the urethral orifice, and injection of contrast, then the patient is imaged. This is the benile urethra, this is the bulbar urethra, this is the membranous urethra, veromontanum and prostatic urethra, bladder neck, and urinary bladder. Regarding the ultrasound, which is another imaging modality, this is the normal appearance for the kidney. This is the capsule surrounding the kidney. From outside, very thin line surrounding the kidney, and the dark gray, this zone is called the cortex, which is the outer part of the renal parenchyma, and the more dark pyramids or medullary pyramids, and in between them there is column of Burton, each medullary pyramid ending into tip, which is called medullary pyramid papilla, then opening into the calyces and the renal pelvis. The second section is also finished. Let's go to the most important for our exam, which is common pathological diseases of the urinary system. To get the full mark in the exam, you must comment into 2 steps. Must write the full comment of the type of the examination, either PUT or KUB, or plain X-ray of the abdomen and pelvis, or contrast study, whatever IVU or ascending urethroplasty or cystography. And the second portion of the answer is the sign or the disease you can see in the image. The common pathological diseases of the urinary system can be subdivided into 3 main portions: congenital anomalies, urinary tract stones, and urinary tract masses. Let's start with congenital anomalies. Congenital anomalies of the urinary system may be anomalies in the position or site, as ectopic kidney, mainly common to be in the pelvis, or malrotation. Anomalies may be in the shape or form, such as horseshoe kidney, cross-diffused ectopic kidney, pancake kidney, renal hypoplasia. May be anomalies of the number, such as agenesis, which is may be unilateral or bilateral, but it is fatal condition, or maybe extra kidney. Others, such as congenital PUG or pelviureteric junction obstruction, renal duplication, and ectopia vasica. The first congenital anomalies is anomalies of the position or site, which is ectopic kidney. This is the normal embryology of the renal tissue in the fetal life. The kidney is formed in the pelvis and then undergo ascent upwards to reach its final destination in the lumbar region, and getting its blood supply from the abdominal aorta through renal arteries on both sides. If there is arrest of this condition in the fetal life, the kidney will be ectopic in its position, maybe in the pelvis, slightly upwards in this pathway, but it's very common to be ectopic in the pelvic region, like this condition. So in the imaging, this is a case of ectopic kidney. This is an IVU. We know it's IVU or PUT by we can see here contrast medium or brightness of the contrast, so it is a contrast study, not PUT or KUB. This is IVU, this is the urinary bladder, and this is the kidney with its redundant ureter. The kidney is abnormal in its position and ectopic in its position in the pelvis. So it's a case of ectopic pelvic kidney on the right side. Don't forget to write right or left-sided lesion to get the full mark in the exam. So to full comment on this picture, we will say it's IVU with right ectopic pelvic kidney. Another congenital anomalies is renal duplication and duplication of the ureter. What's meant by renal duplication? Renal duplication means duplication of the pelvic-calyceal system is duplicated, means it's twice, not one, and may end in one ureter or may end into two ureters but united in its pathway with one vesico-ureteric orifice, or may be duplicated renal duplication or renal duplex with duplicated ureter till its end with two vesico-ureteric orifices. So the renal duplication and duplication of the ureters may get one of these three forms. Let's start with many examples for this condition. It's a contrast study. Its type is IVU, showing renal duplication or renal duplex on the right side and renal duplex on the other side also, with ureteric duplication on both sides till its end. So it's IVU, bilateral renal duplication or duplex system with bilateral duplicated ureters. Another example, on the left side, it is IVU, renal duplication or left-sided renal duplex system with duplicated ureters. Another example, this is a bilateral renal duplication or renal duplex system with duplicated ureters, and also showing dilatation of the upper portion or called upper moiety on the left side. So to get the full mark, it's IVU, showing bilateral renal duplex system with duplication of both ureters and dilatation of left upper moiety. The third congenital anomalies after ectopic kidney and duplication is horseshoe kidney. It is abnormal in form or shape. What's meant by horseshoe kidney? It is abnormal connection of the lower pool of both kidneys in the midline in front of the abdominal aorta with abnormal rotation of their pelvic-calyceal system. This is the horseshoe, so-called horseshoe kidney, as it's like the shoe of the horse. This is a picture of contrast study, IVU, showing abnormal rotation of pelvic-calyceal system on both sides, and this is the renal tissue shadow with abnormal connection of the lower medial aspect of both kidneys in the midline in front of the midline or spine. So it's case of horseshoe kidney. The full comment is IVU, horseshoe kidney. Another example for IVU, abnormal rotation with abnormal connection in the midline between the renal tissue. So the full comment is horseshoe kidney, IVU, horseshoe kidney. This is a picture of CT scan, axial cut, and this is the left kidney and this is the right kidney with abnormal connection between both kidneys in the midline in front of the abdominal aorta. So it's CT scan showing horseshoe kidney. Another example for IVU of horseshoe kidney and CT scan for horseshoe kidney. The fourth one of congenital anomalies is cross-diffused ectopic kidney. What's meant by cross-diffused ectopic kidney means that the kidney on one side is crossed to the opposite side to get fused with the lower pool of the kidney on the other side, but its ureter is crossing to its normal end in the normal vesico-ureteric orifice on its normal site. So it's called crossed fused ectopic kidney, as it's crossing to the opposite side to fuse with the other kidney. This is an IVU, as we can see contrast filling the pelvic calyceal system and ureters, and we can see the left pelvic calyceal system and left kidney is crossing to the opposite side to fuse with the right kidney. So it's crossed fused ectopic left kidney with its ureter ending into the normal left vesico-ureteric orifice. So the full comment is IVU showing crossed fused ectopic left kidney, and this is an ultrasound picture which is quite more difficult, showing the left kidney is fused with the right kidney. Another example, the left kidney is crossed to fuse with the lower pool of the right kidney. The important is contrast study to be known to our level. This is IVU showing crossed fused ectopic left kidney. The fifth congenital anomalies is congenital pelvic-ureteric junction obstruction. What's meant by pelvic-ureteric junction obstruction? This is the normal calyces, normal renal pelvis with normal caliber ending into the normal caliber ureter to end into the urinary bladder. This is the case of pelvic-ureteric junction obstruction with ballooning and proximal dilatation and marked hydronephrosis into the pelvic calyceal system and renal pelvis with still normal caliber of the ureter on this side. So means that there is pelvic-ureteric junction obstruction and atrophy of the renal parenchyma. This is IVU, as we can see contrast filling the pelvic calyceal system, showing marked hydronephrosis or marked dilatation and ballooning of the renal pelvic calyceal system with ballooning of the renal pelvis. At the pelvic-ureteric junction there is obstruction with normal caliber ureter on this side. So this is IVU showing left marked hydronephrosis with congenital pelvic-ureteric junction obstruction, giving this picture appearance of balloon on a string sign like this image. It is a case of congenital PUG obstruction. Another IVU showing marked hydronephrosis and ballooning of pelvic calyceal system and renal pelvis on the left side with normal caliber ureter. So it's IVU showing balloon on a string sign or congenital PUG obstruction with left marked hydronephrosis. The sixth one is ectopia vesica in the congenital anomalies of the urinary system, or called urinary bladder extrophy. This is the clinical appearance of the patient. This is a child or infant baby with absent anterior abdominal wall. There is defect in this region and a defect in the anterior urinary bladder wall also, and the posterior urinary bladder wall is exposed to the outside. And this patient showed also diastasis or widening of the symphysis pubis. So this case is PUT, ectopia vesica or urinary bladder extrophy, as there is widening or diastasis of the symphysis pubis. We finished the congenital anomalies of the urinary system. Let's go to the second section of the pathology, which is urinary tract stones or calculi. The stones of the urinary system may be radio-opaque or dense in X-ray or CT, or may be lucent. The most important one in radio-opaque stones is calcium stones, calcium oxalate, calcium phosphate, may be struvite stones or cysteine stones, may be radiolucent as uric acid stones and xanthine stones. Many locations or sites could be detected, maybe in the minor calyx or major calyx, maybe in the renal pelvis, maybe in the pelvic-ureteric junction, or any portion of the ureter with its three parts, maybe in the vesico-ureteric orifice, maybe in the urinary bladder or the urethra. And the stones may be single or multiple, may be variable in size and variable in shape. Many examples could be seen for renal stones. This is a case of PUT or KUB, as no contrast could be detected in this image. and we can see here a radio-opaque shadow in the region of the right kidney, likely to be right renal stone. However, this region also there is a gallbladder, and the differential diagnosis is gallbladder stone. So the full comment is PUT showing radio-opaque shadow at the region of the right kidney, likely to be right renal stone with differential diagnosis gallbladder stone, and a note is done for multiple small calcified foci in the pelvis, which is multiple philipoli in the pelvic veins as calcifications in the pelvic veins. Another example, this is PUT as no contrast could be detected in the image. There is two radio-opaque shadows also in the right hypochondrium, maybe two right renal stones or two gallbladder stones. However, complementary ultrasound is done showing it is gallbladder stones, which is this black structure showing two stones inside. Another example for PUT as no contrast could be detected in the image, showing two stones in the region of the right kidney, one in the renal pelvis and one in the lower calyx. The full comment is PUT or KUB or plain X-ray of the abdomen and pelvis showing two right renal stones. Another example, it is PUT, no contrast could be detected, so it's PUT or KUB showing multiple small stones in the region of the right kidney, and also there is a small stone could be detected here in the region of the lower end of the ureter or its lower third. So the full comment is PUT showing multiple small right renal stones and left lower third ureteric stone. Another one, also PUT, the same as before, showing radio-opaque shadow in the region of the left kidney, left renal stone, and another one in the region of the pelvis, urinary bladder stone. The full comment is PUT showing left renal stone and urinary bladder stone. Again and again, another PUT showing radio-opaque shadow in the region of the left kidney. This is the shadow for left kidney. And another radio-opaque shadow could be detected in the region of the left ureter. This is the middle portion of or middle third of the left ureter opposite the sacroiliac joint. So the full comment is PUT showing left renal stone and left ureteric middle third stone. Another PUT showing right upper third ureteric stone, which is opposite to the lumbar vertebrae transverse processes, and multiple small lower third ureteric stones in this portion in the pelvis. So the full comment is PUT showing multiple left lower third ureteric stones and right upper third ureteric stone. Another PUT, this is the region of right kidney and this is the region of left kidney. There is multiple variable sized renal stones on both sides. The full comment is PUT bilateral multiple variable sized renal stones. There is a mimic or differential diagnosis for the previous image. There is multiple calcified foci, but this is not the region of right kidney, nor the region of left kidney, nor the region of both ureters or urinary bladder. So this picture is picture of multiple calcified mesenteric lymph nodes and entering in the differential diagnosis of urinary stones. So the full comment of this image is PUT showing multiple calcified mesenteric lymph node. This is another form of urinary bladder, urinary tract stones or renal stones, but it is very large size and taking the configuration of the pelvicalyceal system, the renal calyx and the renal pelvis, giving the appearance of staghorn. So it's called staghorn stone. This is a picture of PUT no contrast here. This is not contrast, this is a large stone showing left staghorn stone. Another PUT showing bilateral large staghorn stones. This is not IVU or contrast study, this is PUT. Another PUT showing multiple large stones or radio-opaque shadows along the course of both lower third ureters. So the full comment of this image is PUT showing multiple large lower third ureteric stones on both sides. Another PUT, there is two large sized radio-opaque shadows in the pelvis, likely to be two urinary bladder stones, but it has differential diagnosis if the patient is female patient, as uterine fibroids, calcified uterine fibroids, entering in the differential diagnosis of this case. So the full comment is PUT showing two large radio-opaque shadows in the pelvis with two possibilities: two urinary bladder stones with differential diagnosis calcified uterine fibroids. This patient is female patient with large radio-opaque shadow in the pelvis, but is more likely to be calcified uterine fibroid than the previous picture, as stone is more dense and more homogeneous in its density, but in calcified uterine fibroid it's less likely to be less dense and more heterogeneous. So in this case it's more likely to be calcified uterine fibroids. This is a picture of PUT with IVU imaged after injection the patient of IV contrast media. In IVB, in PUT, there is faint stone in the region of right kidney, there is right renal stone, and after 1 hour with injection of IV contrast media, there is filling defect in the region of right kidney, right renal stone, with mild dilatation of pelvic calyceal system or mild right hydronephrosis. So in IVU it is right renal stone with mild right hydronephrosis. Another case is IVU, as we can see contrast media excreted in both pelvic calyceal system and ureters. There is filling defect in the region of renal pelvis or right renal stone with associated dilatation and back pressure changes in pelvic calyceal system in the right side. So it is IVU showing right renal stone with mild right hydronephrosis. Another one, this is a PUT, and this is IVU. As we can see the pelvic calyceal system here. In PUT there is dense or radio-opaque shadow in the region of the right kidney, likely to be renal stone. In IVU, after 20 minutes of injection of IV contrast medium, there is a stone also in the region of the right kidney with delayed excretion, that it is occurring in cases of renal obstruction by stones or calculi. And we can notice here also there is duplication of the pelvic calyceal system on the left side with duplication of ureter. So the full comment is PUT showing radio-opaque shadow right renal stone, and IVU showing right renal stone with delayed excretion and left renal duplication and duplication of left ureter. Another case, this case of PUT showing there is a stone in the region of the upper part or upper third of ureter, and after injection of IV contrast medium, this is IVU, there is filling defect in the region of the upper third of the right ureter which means that it is a ureteric stone with associated mild dilatation or hydronephrosis. So the full comment is PUT, showing radiopaque shadow with most probably right upper third ureteric stone, and IVU showing right upper third ureteric stone as filling defect with mild right hydronephrosis. Another case, it's IVU, as we can see contrast filling the urinary system. There is stone seen in the lower third of the left ureter with mild dilatation of all the walls of the left ureter with dilatation of the pelvic calyceal system as a whole, so-called hydroureteronephrosis. Hydro means water or dilatation by urine. Uretero means dilatation of the ureter. Nephrosis means dilatation of the pelvic calyceal system of the kidney, so-called hydroureteronephrosis. Is IVU showing a stone in the left end or left lower third of the left ureter with mild left hydroureteronephrosis. Another case, it's IVU also, as we can see contrast excreted. There is stone seen in the lower third of the left ureter with mild hydroureteronephrosis. Again and again, IVU. There is stone or filling defect in the lower third of the right ureter with mild hydroureteronephrosis, and also we can notice there is outpouch from the right lateral wall of the urinary bladder, which is called urinary bladder diverticulum with narrow neck. So the full comment is IVU showing stone or filling defect in the lower third of right ureter with mild right hydroureteronephrosis and urinary bladder diverticulum. Another case, this is a CT scan, axial cuts and the coronal cuts, showing stone which is white in color seen in the lower calyx and in the middle third of left ureter. So the full comment is CT scan showing left renal lower calyceal stone and middle third left ureteric stone, and also this is the PUT of the patient. This is left renal lower calyceal stone and left ureteric middle third stone. This is a picture of stones in ultrasound, appear as white in color with posterior shadowing to it. This is the right ureter with two stones seen inside. So the picture of ultrasound showing two right ureteric stones, but it's more difficult. Another ultrasound picture. This is the urinary bladder, and this is the left ureter, which is markedly or mildly dilated, moderately dilated in its caliber, with stone seen in its lower part with associated left hydroureteronephrosis. Another lesion which is ureterocele, and there is inward outpouch and the dilatation of the mucosa of the ureter in the vesico-ureteric orifice in the urinary bladder, which is called ureterocele. Ureterocele in IVU appear like this image. There is dilatation in the lower part or lower end of the ureter, giving the appearance of cobra head or onion spring. So in IVU it gives cobra head sign or spring onion sign. So in this case it is IVU showing cobra head sign or onion spring sign, right ureterocele. Another case, there is IVU, there is cobra head sign or spring onion sign, right ureterocele, and also there is stone or filling defect in the upper third of the left ureter with left mild hydronephrosis, and the full comment is IVU showing right ureterocele, cobra head and spring onion sign, and stone in the upper third of left ureter with mild left hydronephrosis. We finished the congenital anomalies and urinary tract stones. we go to the third section, which is urinary tract masses, as renal masses, ureteric masses, urinary bladder masses, and prostatic masses. The first part is urinary renal masses. This is a case of PUT. No contrast could be seen. There is a lesion here with calcified wall. Thin calcification could be detected in its wall, so it's a case of right renal cyst. And the full comment is PUT, showing calcification of the wall of right renal cyst. This is ultrasound picture, and this is a cyst, appear black in color. So the comment is ultrasound showing renal cyst, and this image is CT scan showing also renal cyst, which is gray in color. Another example, but for renal mass. This is the kidney, and there is mass arising from it. So the comment is renal mass, and this lesion also is renal mass in CT scan. This picture is IVU, showing irregular shaggy appearance of filling defect that could be seen in the renal pelvis. This is the calyces, and this is the pelvis, and this is the ureter, and also in the upper part of the ureter there is irregular filling defect. So the full comment is IVU, showing irregular shaggy filling defect could be detected in the left renal pelvis and the upper ureter, mostly to be urothelial tumor or transitional cell carcinoma, malignant in nature. Another picture, this is IVU. This is excretion of contrast in the urinary system. There is multiple variable sized rounded shaped filling defects along the course of the renal pelvis and ureter till its lower end. This case of bilharzial ureters, or called ureteritis cystica, and the full comment is IVU, showing multiple filling defect in the right ureter, or called bilharzial ureter or ureteritis cystica. Another example for renal masses or ureteric lesions. This case is IVU, showing filling defect in the region of the vesico-ureteric orifice in the urinary bladder, so caused obstruction of the vesico-ureteric orifice with dilatation of the proximal whole course of the ureter and pelvic helical system. And this is CT scan of the same condition. There is also thickening or mass lesion in the region of the urinary bladder at vesico-ureteric orifice. So the full comment in the IVU is IVU, showing left vesico-ureteric obstruction with filling defect in the urinary bladder and left hydroureteronephrosis. Another IVU showing, this is the urinary bladder, must be homogeneous in density, filled with contrast, but there is filling defect here arising from its left lateral wall and irregular in appearance, so it is malignant in nature. So the full comment is IVU, showing irregular filling defect in the left lateral wall of the urinary bladder, mostly urinary bladder carcinoma. And this is the ultrasound picture of urinary bladder mass from its left lateral wall. Another case, it is IVU. We can see contrast excreted. There is also the urinary bladder here, showing irregular filling defect arising from right lateral wall of the urinary bladder, mostly to be urinary bladder carcinoma. Also, we can see here the pelvic helical system is malrotated with abnormal connection in the midline, which is horseshoe kidney. So the full comment is IVU, showing horseshoe kidney and irregular filling defect in the right lateral wall of the urinary bladder carcinoma. The prostatic lesion may be prostatic hyperplasia or enlargement or prostatic cancer. The benign enlargement or benign prostatic hyperplasia caused in the bladder base benign, smooth, regular elevation of the bladder base with a regular shaped filling defect, like in this image. This is IVU. There is a smooth, large, filling, regular shaped defect in the urinary bladder mass. In the urinary bladder base, it is a picture of benign enlargement of the prostate. Another picture, IVU, showing smooth, regular filling defect into the urinary bladder base, is a picture of benign prostatic hyperplasia or enlargement. But in case of prostatic cancer, there is a regular shaped filling defect in the urinary bladder base, like in this one. This is IVU, showing irregular appearance of filling defect in the urinary bladder base. So the full comment is IVU, showing a regular filling defect in the urinary bladder base, prostatic cancer. Another lesion in the urinary bladder is urinary bladder diverticulum, which is defect in the muscle layer of the urinary bladder without pouches of its wall, maybe narrow neck or wide neck, and may be variable in size, may show stones inside. This is a case of ascending cystogram, as we can see catheter introduced into the urinary bladder with injection of contrast, and there is narrow neck without pouch from its left lateral wall, and this is the negative image of this X-ray. So it's a case of ascending cystogram showing urinary bladder diverticulum or outpouch from its left lateral wall, and this is the ultrasound picture showing the urinary bladder, which is black in color, with diverticulum arise from its wall, and stone, which is bright in color here with shadowing, seen inside the diverticulum. The last lesion in this lecture is urethral lesion. Could be detected by ascending urethrogram. This is the region of penile urethra in male, and this is narrowing or structure in its caliber. So the full comment is ascending urethrogram with structure in the penile urethra. We finished the lecture, but we should revise. The common pathological diseases we can detect may be congenital anomalies, stones or masses. Congenital anomalies as ectopic kidney. The full comment is IVU, right ectopic pelvic kidney. Renal duplications with duplicated ureters, with many examples. IVU showing left renal duplication with duplicated ureters. IVU showing bilateral duplication with duplicated ureters on both sides with dilatation of left upper moiety. IVU showing horseshoe kidney. IVU and CT showing horseshoe kidney. The same. This is IVU for cross-diffused ectopic left kidney. This is a picture of IVU showing left marked hydronephrosis and congenital pelviureteric junction obstruction, Pallone on string sign. The same. And PUT showing ectopia vasica or urinary bladder extrophy. The stones. This is PUT showing radiopaque shadow in the region of the right kidney, mostly right renal stone with differential diagnosis gallbladder stone. The same. This is PUT showing two right renal stones, one in renal pelvis and one in lower calyx. PUT showing multiple right renal stones with left lower third ureteric stone. PUT showing left renal stone and urinary bladder stone. PUT showing left renal stone and left middle third ureteric stone. PUT showing right middle upper third ureteric stone and multiple left lower ureteric stones. PUT showing multiple bilateral variable sized renal stones, multiple calcified mesenteric lymph nodes, PUT showing left staghorn stone, PUT bilateral staghorn stones, PUT showing multiple variable sized large bilateral lower third ureteric stones, PUT showing 2 large radiopaque shadows in the pelvis, mostly 2 urinary bladder stones with differential diagnosis 2 calcified uterine fibroids, PUT showing radiopaque shadow in the pelvis, likely calcified uterine fibroid, PUT showing right renal stone, and IVU showing right renal stone as filling defect with right mild hydronephrosis. The same. PUT showing right renal stone, IVU showing right renal stone with delayed excretion with duplication of renal system and duplicated ureter on the left side. PUT showing radiopaque shadow in the upper third ureteric stone, IVU showing upper third right ureteric stone as filling defect with mild right hydronephrosis, IVU showing stone at the lower third of the left ureter with mild right hydroureteronephrosis, IVU showing stone in the lower third of the left ureter with mild left hydroureteronephrosis, IVU showing stone in the lower third of right ureter filling defect with mild right hydroureteronephrosis and urinary bladder diverticulum, CT showing left lower calyceal stone and the middle third of left ureter stone, and the same in PUT, ultrasound showing 2 right ureteric stones, IVU showing ureterocele copperhead sign or spring onion sign, the same. Don't forget to write right or left. IVU showing right ureterocele and left upper third ureteric stone and mild hydroureteronephrosis. Calcification in the wall of the right renal cyst, ultrasound of renal cysts, CT of renal cyst, ultrasound of renal mass and CT of renal mass, IVU showing irregular filling defect in the renal pelvis and upper ureter, mostly transitional cell carcinoma, IVU showing multiple filling defect in the course of right ureter, bilharzial ureter or ureteritis cystica, IVU showing left vesico-ureteric obstruction with irregular filling defect in the urinary bladder with left hydroureteronephrosis, IVU showing irregular shaped filling defect in the left wall of the urinary bladder, mostly urinary bladder carcinoma, and ultrasound picture of the same case, IVU showing irregular filling defect in the right lateral wall of the urinary bladder, mostly urinary bladder carcinoma, with also horseshoe kidney, smooth regular filling defect in the urinary bladder base, benign enlarged prostate, the same case, irregular filling defect in the urinary bladder base, mostly prostatic carcinoma, ascending cystography or cystogram showing urinary bladder diverticulum from left lateral wall of the urinary bladder, and ultrasound picture showing urinary bladder diverticulum with stone inside, and the last one is ascending ureterogram or ureterography with stricture in the penile urethra. Thank you very much for your listening. Hope the lecture is fruitful and interesting for you. Thank you very much.